Hey everyone, welcome to one more video here in the Meta-Analysis Academy. In this video, we're going to learn about 3 common mistakes in the statistical analysis and interpretation of your paper that will kill your article, and it will increase dramatically the chances of rejection. Before we go any further, remember to subscribe to the channel and hit that like button. And also, join the Meta-Analysis Academy waitlist. We'd be happy to consider you for a position in our meta-analysis training program. So what are these 3 common mistakes that people often make? First of all, is to interpret statistical significance without considering clinical relevance. Let me explain. So a p-value less than 0.05 shows statistical significance. But you must also consider the magnitude of effect, the effect size. If the relative reduction or the absolute reduction is minimal without any clinical implication, it doesn't matter what the p-value is, there is no clinical effect. And you shouldn't mistake a p-value less than 0.05 as clinical relevance when writing your discussion, for example. If you have a p-value of 0.03, but the magnitude of effect is so small, you shouldn't talk about that finding as being a positive and clinically relevant finding. So make sure to look at things like relative risk reduction, absolute risk reduction, the hazard ratio. Look at the effect size and not just the p-value for statistical significance. The second common mistake is to make multiple comparisons without considering the risk of type 1 error. So when you do multiple tests, whether it's in a meta-analysis or in a clinical trial, let's say you do multiple subgroup analysis, for example, you may have a statistical p-value less than 0.05 due to chance alone. That's right. This is called a type 1 error, or a false positive finding. So if you do multiple testing in your meta-analysis or in your research paper, you should be aware of the risk of type 1 error. In fact, you can even make an adjustment for multiple testing. You can adjust your p-value considered as a threshold for clinical significance based on the fact that you're doing multiple tests. At the very least, make sure to mention this as a limitation if you don't do the correction. Make sure to mention that there's the risk of type 1 error because you did multiple tests and you didn't correct your p-value. So finally, the third common mistake is to disconsider or disregard the sample size when interpreting a p-value more than 0.05. So a p-value greater than 0.05 means that there was no statistical significance. But what if the sample size was insufficient? What if you didn't have enough statistical power? This happens in clinical trials for secondary outcomes, but it can also happen in a meta-analysis. When you do a meta-analysis, there's a tool that can be used to analyze, to look into this, whether there was insufficient power for that specific outcome, that specific analysis. This tool is called Trial Sequential Analysis, and we teach you how to use it in the Meta-Analysis Academy. So again, I want to invite you to join our waitlist for the Meta-Analysis Academy training program. I'll see you in the next video.